it's time for us to continue in our community development segments and have a conversation about maternal mortality in the Northeast region. But before we go to that, I just want to mention again that, look, the DCE of Whole West District, this is right on your lap. You can't avoid it. Whatever is going on there, at least bring some clarity. Come and explain yourself. Let's know what the issue is here. Because it seems to me that something very untoward is happening. And it's like people who have more power and control are doing things to disenfranchise those who cannot speak for themselves and those who cannot, stand up for themselves. It's very despicable as, leadership. I understand he's Honorable Ernest Apau, DCE of Whole West District. If that is, look, I don't understand what's going on there, but maybe we are wrong, maybe I'm wrong. Look, if I'm wrong, we need to hear from you, okay? But it seems to me that something very untoward is going, where people of influence and people of power have the opportunity to disadvantage others who don't have the power and the place, a donor has come to give you a pump that will serve a community of thousands of people. Then someone takes that pump away, okay, and replaces it with a tiny pump that cannot do much, right? And then from what I'm hearing, the DC says that the community doesn't take good care of whatever is given to them, and so he's left them to their own devices. It's absolutely unacceptable. Anyway, let's go over to the Northeast region. In the Northeast region, we've had some significant improvement in maternal health, maternal mortality figures. And so we have this report for you. Let's take a look at it. We'll come back and we'll delve into some conversations around it.
Health, they say, is the wealth of a nation. When the citizens are healthy, production will be high. This is anchored on proper health system with all the necessary structures, personnel, and resources. This, however, cannot be set in the country's health system. In some areas, either the structures, personnel, or the equipment are unavailable, making it difficult for the citizenry to access quality health care. One major challenge across the country is the issue of maternal mortality. In the Northeast region, the region has recorded some improvement in the area of maternal mortality. In the year 2022, the region recorded 6 institutional maternal deaths compared to 16 deaths in the year 2021. This brings the institutional maternal mortality ratio to 30.5 per 100,000 live births in 2022 compared to 84.8 per 100,000 live births in the year 2021, with the national target being 125 per 100,000 live births. This is significant to efforts in achieving the Sustainable Development Goal 3, which is to ensure healthy lives and promote well-being for all ages by 2023. The objectives of the goal is to increase life expectancy and reduce some of the common killers responsible for child and maternal mortality. Dr. Abdullahi Abukari, Northeast Regional Health Director, at the 2022 Annual Performance Review meeting said, maternal mortality has been a major challenge in the region, describing it as worrying. He outlined some measures his outfit has put in place to address the challenge.
Was carefully chosen in view of the huge financial, human resource, infrastructure, equipment, and transportation challenges that confront us as a new region. But it is poised and working hard towards achieving universal health coverage. Therefore, we believe that the mobilization of resources from everywhere for the establishment of a functional and resilient health system cannot be overemphasized. Dr. Chair, as expected, The effect of the COVID-19 pandemic over the past 3 years, together with other global challenges, affected health service delivery nationwide. And as a new regime, we had and still continue to have our fair share of the impact. These global happenings and challenges have also stretched and tested the resilience of our health system to its elastic limit. And one of the bitter lessons that we have all learned is that we necessarily have to work together as stakeholders. We need to put resources together and invest massively in strengthening all the building blocks of our health system to be able to provide quality health service and work towards achieving universal health coverage. We therefore, Dr. Chair, believe that in our efforts towards achieving universal health coverage, we need to adequately mobilize the needed resources from all stakeholders and effectively deploy these resources in implementing cost-effective interventions so as to strengthen our health system. Hence, it is important to solicit the views of stakeholders.
Meanwhile, in the year under review, clinical services in the Northeast region, both outpatient and inpatient services, registered a slight increase in 2022 compared to 2021. In 2022, the region's OPD per capita stagnated at 0.75, which is below the target of 1%. The proportion of unsecured patients at OPD decreased marginally from 87.5 in 2021 to 85.6 in 2022. Director Abdullahi Abukare observed one of the things that accounted for this decline, in addition to non-availability of medicines across health facilities, was the operation of several unlicensed over-the-counter medicine shops and drug peddlers across the region, stressing some operators detained and admit patients in their shops. He noted this has, however, been brought to the attention of FDA and Pharmacy Council for redress. On his part, member of the Ghana Health Service Council, Mr. Franklin Osu Ansah, commended the regional directorate for the success achieved. He urged all stakeholders to help in promoting quality health service in the region.
You would also bear with us that our health workers demonstrated commitment and resilience in the face of the pandemic. Between life and death, they were there. They saved countless lives, and many of them became infected whilst saving lives. While others paid the ultimate price in the service of others as well. Again, they kept up their hard work to improve our health indicators, even in the thick of COVID-19. Hard work and sacrifice of health workers deserve recognition. And so during our tour, we assured you that we will support management in establishing an award scheme to recognize and appreciate our hard-working health workers. As a council, we are delighted that management has launched the Ghana Health Service Excellence Award Scheme and has put in place a comprehensive framework to assess and award best performing individual staff, facility leaders, as well as institutions at the various service levels across the country.
All right, so that is some bit of good news, I might say.
It's good news.
Especially if
I think
have,
it is good news.
Dropping maternal mortality rates, that's always a good thing. Because mothers they need a break, I mean, honestly. And in that sector, of course, what we realize is that it's not just, of course, in a hospital, you have so many different aspects of things, right? You're dealing with OPD, you're dealing with different sections and all of that. Then there's the issue of maternal.
Exactly.
Mothers coming in, antenatals, the birth process, postnatal care, and all of that. But if the figures are dropping for mortality rates among mothers, then that's a good thing. Or it means something is being done right.
Right. And from what he said, the whole antenatal clinic,
Yeah.
it actually increased the number this year compared to the past years.
Yeah.
Yeah. So that means like the women are beginning to take it more seriously.
More seriously.
Yeah.
Yeah.